What you're about to see will change your view of implant dentistry. What has been called the biggest revolution in modern-day dentistry will expand your treatment capabilities and bring additional profits to your practice. For the first time, you, the dentist, can give your patients new teeth in hours instead of months. First, let's talk about implants. When a cylindrical implant is placed into a prepared site, the surgeon must wait 4 to 6 months for osseointegration to occur. That is, for bone to grow in intimate contact with the surface of the implant. After the waiting period, a second surgery uncovers the implant and its stability is determined. If the implant is not stable, the process must begin again, but only if conditions in the implant site are favorable and the patient is willing to tolerate the additional procedure. If osseointegration has been achieved, the restorative process can begin. When a Sargon Dental implant is placed and expanded in the prepared site, the amount of space between bone and implant is diminished. Since the implant is in intimate contact with the bone, with reduced micromotion, osseointegration is encouraged. Your patient leaves with a functioning temporary on their way to a final restoration while maintaining their own original emergence profile and tissue health. Let's look closer at how the Sargon Dental implant works.
Inside the implant is a fixed screw. At the bottom of the screw is the expansion nut. By turning the internal screw, the expansion nut travels upward, expanding the apical portion of the implant. This process can be reversed if necessary. Because the implant is wider at the apex, the lateral forces of occlusion are transferred apically instead of to the crestal area, which is the case in all cylindrical and screw implants. This results in great reduction of continuous crestal bone loss, which previously had been the accepted standard in the dental implant industry. Let's look at how this implant works with bone. Areas of the mandible and maxilla are categorized as having different types of bone, from type 1, dense compact bone, to type 4, spongy and soft bone. Previously, only CT scans combined with computer-aided analysis gave you, the clinician, the ability to determine the type of bone in a specific area prior to implant surgery. When the Sargon Dental implant is expanded, you have, for the first time, the ability to directly feel the bone adjacent to the implant. The degree of implant expansion will give you vital information on the specific type and quality of bone at that site. At this time, you are in direct communication with bone, and the implant tells you whether the bone in that site can be immediately loaded. Expansion of the implant compacts the localized bone, encouraging reparative bone growth and osseointegration. As with any procedure for success, a few rules must be followed. Make sure you have thoroughly evaluated the patient's medical and dental health for contraindications. Plan the case in advance with other members of the treatment team and practice proper radiographic techniques. Follow the Sargon surgical protocol. Now let's do a comparison of present implant techniques and the Sargon technique. Under the present protocol, a patient may expect tooth extraction, wait 6 months. Soft and hard tissue augmentation surgery, wait 6 months. Implant placement surgery, wait 6 months. Uncovering the implant surgery, wait 2 to 3 months. Begin restoration process. This process frequently takes 2 to 3 years. With the advent of the Sargon implant system, which represents the future of implant dentistry, this entire process can be performed in a matter of hours. This surgical procedure shows the placement of a Sargon dental implant in the left central incisor following tooth extraction.
The tooth socket is debrided of all soft and fibrous tissue. Then a series of drills and taps are used to prepare the surgical site. The implant is placed and expanded. The abutment is placed and the integration is checked by tapping. Any needed augmentation is performed at this time. The temporary is fabricated and delivered.
Post-operatively, the patient must be seen at 1 week, 2 weeks, and 3-week interval to make sure the implant is fixed intimately with the bone and no micromovement has occurred. At this time, you, the clinician, can determine the bone's ability to withstand occlusal loading before failure can occur. If there is any micromovement, the implant will be sensitive to percussion. In these cases, the implant must be expanded further to reduce micromotion and enhance contact with the bone. Prior to the development of the Sargon implant, implant failure was often discovered 6 months after implant placement and at times even after the final prosthesis was in function. The Sargon Dental Implant now gives you the capability of rescuing an implant anytime after placement and loading. With the immediate fixed abutment restorative components, traditional crown and bridge techniques may be used without the fuss of tissue retraction cords and anesthesia. The immediate fixed abutment is securely seated on the implant's 1 mm external beveled hex, which ensures proper centering of the abutment onto the implant. The immediate fixed abutment retaining screw will conform to the shape of the inside of the crown restoration so that the abutment screw cannot loosen. By using the treatment crown sleeve, we can enhance the aesthetics and strength of the treatment crown, which maintains the tooth's original emergence profile. An accurate laboratory transfer of the position of the abutment results in an efficient and precise fit of the restoration to the implant.
Using the Sargon Dental Implant System with its expansion capabilities, you begin the process of direct communication with the bone at placement. Sargon Dental Implants can be used wherever implants are indicated, from the single tooth to full mouth reconstruction and the overdenture. The Sargon Dental Implant more closely duplicates nature and functions as a single-rooted tooth in dense bone, which is normally found in the anterior region, or as a multi-rooted tooth in less dense bone, which is normally found in the posterior region. With the Sargon Dental Implant System, you save time, money, and patient discomfort. With the Sargon Dental Implant System, we are redefining success in implant dentistry. For product information and surgical courses, contact Sargon Dental Implants at 1-800-641-2905.